Nicole Bruckman. Hey, how are you? I'm Anna. I'm gonna be your nurse today. Oh gosh, what'd you do?
So I rolled my ankle.
Oh no.
I got stung by a bee, I think, and I was running. Ow, that hurts. And I think I rolled my ankle.
Okay. We're gonna go into this room right here.
Okay.
Oh gosh. We'll just have you have a seat on the chair.
For here or there?
Yeah, you can have. There you go.
Diphenhydramine, Benadryl, is an antihistamine used to relieve symptoms of allergy, hay fever, and the common cold. These symptoms include rash, itching, watery eyes, nose, throat, cough, runny nose, and sneezing. This medication works by blocking histamine, which is a natural substance your body makes during an allergic reaction. Its drying effects on such symptoms as watery eyes and runny nose are caused by blocking acetylcholine, which is another natural substance your body produces. Side effects include drowsiness, dizziness, constipation, stomach upset, blurred vision, or dried mouth, nose, and throat. If any of these symptoms persist, please tell your pharmacist or your doctor immediately. Ibuprofen belongs to a class of drugs called non-steroidal anti-inflammatory drugs, also known as NSAIDs. It is used for management of mild to moderate pain, fever, and inflammation. Pain and inflammation are prompted by the release of chemicals in the body called prostaglandins. Ibuprofen blocks the enzyme that makes prostaglandins, resulting in lower levels of the enzyme. As a consequence, inflammation, pain, and fever are reduced. Side effects include rash, ringing in the ears, headaches, dizziness, and drowsiness. Prednisone is a corticosteroid that prevents the release of substances in the body that cause inflammation. Prednisone treats many different conditions, but is often used for its potent anti-inflammatory effects. Steroid medication can weaken your immune system, making it easier for you to get an infection. Avoid being near people who are sick or have infections. Call your doctor at once if you have shortness of breath, severe pain in your upper stomach, bloody or tarry stools, severe depression, changes in behavior, vision problems, or eye pain.
Alright, so I have talked to Dr. Brown and she has prescribed you 3 prescriptions today. So we are going to give you an anti-inflammatory. We're going to give you some ibuprofen, also known as Motrin.
Okay.
And you are going to take that every 8 hours. It's 800 milligrams. You're going to take it for 2 days and then you're going to take it as needed. This is going to be for your swelling, and it's going to help you with that. You want to take it with food, because it does tend to kind of upset your tummy. So make sure you take that with something, okay? The cost for that is going to be about $7 to $20 a bottle over the counter, but if you have insurance, it'll definitely cut that cost down for you. Okay? And then we're also going to give you Benadryl, which is an antihistamine. That's going to help with your bites and the itching that's going on right now. Biggest thing with Benadryl is that you do not want to take it with alcohol, because it's going to increase that drowsiness effect. Okay, so avoid that. You're going to take about 1 to 2 tabs every 6 hours as needed for itching. Biggest thing is that it's going to make you sleepy, so make sure that you are not driving or operating any heavy machinery on this medication. That's going to run you about $4.99 to $20 a bottle, depending on where you get it. If you have insurance, again, it'll be way cheaper for you.
Okay, perfect.
The last thing that we're going to give you is a prednisone, and that's a steroid, and that is actually also going to help with like your hives and the itching, histamine response in your body. And you're going to take that for 5 days. We're going to give you 60 milligrams of that. Okay. Biggest thing with prednisone is your hunger, your appetite will probably increase, so you want to take plenty of fluids with that as well. And it can cause some jitteriness or some palpitations. That is normal. If your rash comes back, call the doctor, let us know, because we may need to do a tapering dose for you.
Okay.
This one's going to be the most expensive. It's going to be about $224 to $400 depending on the generic or trade name. But if you have insurance, then it'll bring that cost down.
Perfect.
Okay, good. All right, do you have any questions for me today?
I don't.
Okay, all right, well, let me get this discharge paperwork ready and we'll get you ready to go.
Thank you.
You're welcome.
All medications discussed in this video are to be taken by mouth. However, these medications are available via other routes. Talk to your provider or pharmacist if you have further questions or concerns.